Go.
Hi, my name's Chelsey. I'm the practice manager for this clinic, and I just have some questions I would like to ask you.
All right.
How are you doing today?
I'm good. How are you?
Did you find the place okay?
I did.
Okay.
Came early.
All right. So what have you heard about this clinic?
Can we pause? I'm sorry. What type of clinic is it?
I said, what have you heard about this clinic?
Well, you've been in practice for about 50 years now, so it's a pretty experienced clinic. And you focus primarily on elderly patients. So I've always worked with the elderly. I'm a CNA. I've worked in group homes, nursing homes. I've done home health care.
What are some skills you have that would contribute to us?
Well, like I said, I've previously been a CNA, so I can assist with daily living, bathing. I know how to transfer from wheelchair to bed to wheelchair, walker. You know, I can do all of that. And now with my CMA, I'm also trained in phlebotomy, EKG.
Good thing is you won't have to give anybody a shower.
Yeah. Okay.
Relax on that. And then, as an MA, what areas do you feel you need to improve on?
Well, I feel like there's always room for improvement. Whatever I can learn, I'm willing to.
What do you like the most and the least about being an
What I like most is I'm able to work in every area in the office. I can work in the front, I can work in the back, I can do clinic, I can do administrative. And the least, maybe the least is I don't get to do enough. I want to have my hands in everything.
So what can you do as an MA to make sure you follow the HIPAA rules?
Well, I will always make sure when we need to communicate about a patient, we would do it in a private area, not in the middle of the hallway or at the nurse's station. If I'm talking to a patient, I would make sure they're in a private room and not in the waiting area or in the hallway.
How would you treat a patient that suddenly fell unconscious?
Well, first I would check their pulse and check their breathing, make sure they're still breathing, and I would immediately call for help.
What made you decide to apply for this position?
Well, like I said, I've always worked with elderly patients, so I thought what would be better than to work with elderly using my CMA instead of my CNA.
What would set you apart from the others?
Well, I'm a great team player. I always want to help wherever I can. I always want to receive help whenever I can. I always want to learn. So I'm always in everybody's, space without invading, but I always want to learn more.
Are you planning on doing any continued education?
Yes, every year. We have continued education courses, seminars, so I plan on attending all of them.
Do you have any questions for me?
Yes. Do we usually work, do we usually go into like overtime?
It depends on the day. If more patients come in that need more extensive work, then we might work a little bit over, but not usually. Usually we'll get a heads up in the beginning of the day so you can make arrangements.
Either way is fine with me.
So you're pretty open and flexible.
I am, of course.
All right.
Thank you.
Thank you.